The Mental Health in Aviation Act has been referred to the Committee on Commerce, Science, and Transportation. What's in the act? Hi, I'm Morgan, and this is an aviation safety update. I'll link everything below in the comments, but this is HR 2591, the Mental Health in Aviation Act of 2025. This act has already passed the House, and this was received by the Senate on September 9th. It was introduced by a representative in Illinois, and it has now been referred to the Committee on Commerce, Science, and Transportation. But what's in it? I'll also link the summary in the comments below. So this was introduced in the House on April 2nd, 2025. This requires the FAA, Federal Aviation Administration, to review and update its regulations and policies on mental health for pilots and air traffic controllers. It states that the FAA must update regulations and take other actions necessary to implement recommendations of the Aviation Workforce Mental Health Task Group, the Mental Health and Aviation Medical Clearances Aviation Rulemaking Committee, the ARC. It also states that the FAA must also annually review and update, as appropriate, the applicable regulations and policies on mental health related special issuance for pilots and air traffic controllers. An authorization for special issuance of a medical certificate is something that's issued by the FAA, and it allows pilots who have a disqualifying medical condition to fly under a restricted medical certificate. Part of this bill includes reclassifying and approving additional medications that may be safely prescribed to pilots to treat mental health conditions. A lot of pilots are either knowingly or unknowingly finding themselves subject to very long processes that can have them removed from their position based off of a medication that doesn't have side effects that prohibit their ability to function as a pilot. The current rules surrounding pilots and air traffic controllers seeking help for mental health conditions or substance abuse are very restrictive. This leads to fear of reporting that you are having this issue, which means that people don't seek the treatment that they need. And the processes to navigate it, if you do report that you're having an issue, are very restrictive. They're long processes, and they can lead to loss of income, loss of job, or loss of medical. Within this bill, it also includes delegating additional authority to aviation medical examiners, AMEs, so those are the doctors who certify that pilots are medically fit for flying, and improving the special issuance process for pilots and air traffic controllers. This bill would also authorize the FAA public information campaign or education efforts to destigmatize individuals in aviation who want to seek mental health care, and broadening awareness of available supportive services, and to establish trust with pilots and air traffic controllers, because there is a lack of trust in those groups because they have a fear of losing their position. AOPA, which is the Aircraft Owners and Pilots Association, also recently covered this bill that has been introduced. The AOPA article includes how some of this money would be spent, and that includes nearly $14 million annually to train and recruit more AMEs. It also includes providing $1.5 million annually for a public information campaign to address the fear and stigma. I want to keep this under 5 minutes, so I'm just going to wrap this up, but this is the Pilot Mental Health Campaign. I will link this in the comments below. I will link all of this below, but the Pilot Mental Health Campaign is a nonpartisan organization that advocates for changes in how mental health issues are addressed and handled in the aviation industry. This is a very complex topic, and so I'll provide several follow-up videos to include some of the medications that are currently excluded, as well as mental health conditions that may limit a pilot or air traffic controller's ability to perform their functions currently. I would also like to follow it up with some of the details of the process of reporting a mental health condition, taking certain medications, or substance abuse. I would love to hear your thoughts, so comment below what you think about this act that's been introduced and how you think it may help improve aviation safety. Follow my page if you would like to stay up to date on aviation safety alerts, travel tips, and general aviation and airline facts.